Hi guys, it's Dr. Denney over at Four Paws at Fulshear, and today Maddie and I are going to be chatting a little bit about cats and allergies and kind of what to look for, what's the most common causes that we can see for cat allergies, what do cat allergies look like, and how might we treat cat allergies.
Dr. Denney, what are some common cat allergies?
So I'd say probably the most common that we see out here is flea bite allergy. So the cats will come in and they're gonna have the most common place to see these symptoms is on their necks. They're gonna have scabs on their necks, or they're gonna be super, I'm talking about fleas, it's making me itchy. That's another thing when you talk about these things, makes you itchy. So I don't have lice, I promise, or fleas, because fleas don't like humans. They don't live on us. So even if your dog or cat has fleas, the good news is they're usually not gonna come bite you. I digress. Okay, so with cats, they're going to be really sensitive around their tail head, and you might see like crusting or black little flea dirt. It looks like dirt. That's actually flea feces, but those are going to be the most common types of allergies that we see out here in Fulshear. The cats will come in super itchy. I would say sometimes we can see like different types of food allergies, and the cat will develop like inflammatory bowel disease or IBD, which is super common in humans as well. But I would say the most common allergy we're going to see is going to be fleas. The second most common is going to be mosquito bite hypersensitivity. So what does that look like? The mosquitoes will bite the easiest place to access on the cat, which is their ears, because they're super thin. There's not a lot of hair there. So the mosquitoes will bite the ears, and so cats will scratch their ears raw. And if I have a cat come in that's, its ears are just like completely crusted and yuck, I'm either gonna think mosquito bite hypersensitivity if we're outdoor, and if we're a young kitten, I might, maybe rule out ringworm as well. But those are gonna be some common allergies that we see.
What preventative care can I provide to help my cat avoid allergies?
So flea and tick prevention, we use Bravecto Plus here. It lasts for 2 months. It also does heartworm prevention. But applying that every other month will protect your cat. I have a lot of cat owners that don't do preventatives at home, but they have dogs, and the dogs are on prevention, but they go in and out of the house, and the fleas are usually only going to die once they bite the dog. So they can hitch a ride on the dog, come in the house, and sometimes they can even come in on us. They may not like us, but they do sense body heat. And so they can hitch a ride, jump off, and get onto a cat. So flea prevention is going to be really important.
What are some signs and symptoms that my cat may have allergies?
So we've talked about a few of them. So we'll talk, we talked about the itching, the scratching, the flea dirt, the scabs around the neck, super sensitive and itchy around the base of the tail. You can physically see fleas sometimes. I usually will tell my clients that cats are such fastidious cleaners and groomers. That means that they groom all the time. They are, they're like OCD about being clean. So it's very rare to see an actual flea on a cat. If you do, that means you've got probably a pretty hefty infestation and you're just seeing the tip of the iceberg. I would say with cats, the other thing that you can look for besides the flea dirt is just super sensitive, a lot of scratching, over grooming. We can see what's called barbering, and that's for different type of allergies. So sometimes cats will get allergic to their own skin mites that live in their skin, and they'll come in and they'll just be bald, like their whole neck, belly, inside of their legs, bald. And we can see that with allergies. Sometimes we can see environmental allergies cause that as well, but usually we'll see an overgrowth of their own skin mites. So those are the most common types of allergies and symptoms that we can see in cats.
Why is it important to avoid self-diagnosing allergies in my cat?
Because what if you're wrong? So what if, you think that you have fleas, but it's actually like a mosquito bite allergy? Or what if your cat actually has food allergies, which even though it is rare, it does happen. What if you're wrong and you're doing all these things and you're putting your cat through unnecessary things, you're spending unnecessary money, and you may be wrong. And then, when you find out you're wrong, not only have you put your cat through XYZ, but you've also spent the money on XYZ, and now we have to spend more money on XYZ at the vet. So it's best to just come see your veterinarian, let us make an appropriate diagnosis, let us help you. We can work as a team. I am super happy when my clients do their research. What that means is I can work with you because you already have the education. A lot of what I have to do is educate owners so they learn about these kind of things. But if you come armed with that information, it's much easier and faster to get a resolution and kind of get you guys back home, because I understand that everyone has limited time and we try to be very respectful of that.
How will a veterinarian diagnose allergies in my cat?
So we've touched on this a little bit. Physical exam is going to be huge. Clinical signs or symptoms. Like if I know a cat that is scratching at their ears, I'm gonna I'm gonna look in their ears. I'm also going to be looking at the skin around their ears and see, hey, is it an infection or is it maybe mosquito bite hypersensitivity? And pending what we see on our exam and what diagnostics we do, like maybe a skin cytology where we do a microscope slide on the skin and stain it and look under the microscope, or a skin scrape where we're looking for skin mites. These tools are how we're going to make a diagnosis, and then based on that diagnosis, we're going to make a decision on, do we need antibiotics? Do we need like a short-acting steroid injection? Do we need any topical therapies? Do we need to wear an e-collar so we stop shredding our ears? Do we have an ear infection that needs to be treated? So there's a lot of different treatments, but we have to do the diagnostics, get a physical exam done, because our patients can't talk to us. I can call my dermatologist and make an appointment and say, I feel itchy and I'm a veterinarian and I'm going to go in and, she's probably going to do an exam, but sometimes they don't, right? Human doctors aren't, we can talk to them so they can hear about our symptoms. Our patients can't talk to us. So that physical exam is so important. And that's something that I went to school for a very long time. I've been out in practice, 10 years now. My physical exam has been honed by all these years of experience. So it's a huge part of diagnosing allergies and also figuring out what form of treatment is going to be the best fit for your cat.
What are some common treatments for cat allergies and how effective are they?
So it depends on what kind of allergies we're seeing. Mosquito bite hypersensitivity, is your cat going outside? Maybe we need to be an indoor cat. Problem solved. So, there are some easy fixes. Is your cat having diarrhea and, we've ruled everything else out and it looks like it's inflammatory bowel disease? Maybe we need to do a diet change, okay? If we have fleas, flea prevention. So the good news is that with allergies, especially of the external parasite kind, there's a fix. Now we have to keep up with the fix. So if you just do one flea treatment, when a flea life cycle is 3 months, but the flea treatment only lasts for 2 months, we're going to be back where we started at the same problem all over again. So please follow the recommendations to the best of your ability. Put a reminder in your phone. Keep up with your rechecks. A lot of antibiotics that we'll use, I will recheck in 7 to 10 days and see where we're at. Some skin infections that are caused by skin allergies or self-trauma require another injection, and it might look fine, but you have to remember, we're only seeing the top layers of the skin. There's so many layers of skin. And so while the top layers may be cured, the bottom layers may be still having symptoms, and you won't see those for a few weeks. So it saves you money to make sure you keep up with your rechecks. So I hope you guys enjoyed this talk about, feline allergies and cat allergies. The good news is that a lot of them are very treatable. Some of them can be a little bit frustrating, but that's why we're here. So give Four Paws at Fulshear a call and you can make an appointment with me or one of my team, and we can go ahead and get you set up and do some education on what we can do to fix your cat's allergies. Thanks.